Well, thank you very much for sitting down to talk with me, Dr. Ulrich. And I've been covering oncology for years, and I think the one thing I've never seen at cancer centers is a cancer center taking on more catchment area. Can we talk about that?
Sure. Well, we're a frontier cancer center, right? We're used to taking on big challenges and pioneering. But maybe I'll explain to you a little bit about how this came about, right? So, since HCI started in 1986, the area that we serve, like that's what we really care about for our catchment area. It's like the term, personally, I don't like it that much because it's catching people versus like the area we serve, right? And that has been since 1986, formerly the state of Utah. But over especially the last 10 years, we have really broadened that commitment across the Mountain West, and that includes 5 states: Utah, Idaho, Montana, Wyoming, and Nevada. And why that? Well, first of all, we're the only NCI-designated cancer center in the region, and cancer patients in these states really need to have access to a cancer center. And already at our last CCSG site visit in 2019, we presented the 5-state Mountain West as our broader area of impact. So it's just a logical step that now we kind of formalized our commitment to both intentionally and meaningfully address the cancer-related needs in these 5-state Mountain West states. And when we considered this, I have to say, a thought that we came quite deliberate to, but we also wanted to make sure that this is what the NCI wants us to do. And we discussed it with Henry Ciolino, and he was enthusiastic. He was enthusiastically endorsed this. And then we discussed it with our external advisory board. And then perhaps most important, we discussed it with our community advisory board. And just so that you're aware, so our community advisory board has actually, since its inception, already included members from all 5 Mountain West states. And we've already developed with them their state cancer plans. We've engaged and brought them together and aligned. And so all of this has already happened. But nevertheless, we realize this is a big lift. It's bold and ambitious, and it means that HCI effectively serves the largest geographic landmass of any NCI-designated comprehensive cancer center in the country. And so that equates to about 17% of the continental US landmass. So much for that as the history.
Wow. Just getting back kind of to sort of the question itself, which is the reason cancer centers generally don't want to take on more catchment area, let alone such a great one, is that then it's easier to show impact in a smaller area. So what you have now is what you've just described. 17% of the United States landmass.
Yeah.
Wow.
Well, I have to say, we have a very ambitious team here, and people who really want to change the world and move the needle. And for example, Dr. David Wetter, who leads the Center for Health Outcomes and Population Equity. And he's originally from Idaho. And he has made a tremendous impact since he came here, working with our federally qualified health centers across Utah. But he recently said, well, there's a much bigger need than just Utah. Nobody else is doing it. So we're looking at this really from the population health angle, that nobody else is doing it. There's an unmet need, and we would like to do it, and we're poised to do it. And so we know we can't do everything at once, right? I think there are some cancer centers that are very particular with their catchment areas and think, well, we have to meet this number and this number and this number. And we talked to Henry about that and our EAB, and we just feel like this is an unmet need. We're not going to be perfect at doing it, but we're going to move the needle, at least in some parts. and nobody else is doing it. So that's where we're coming from, right? And there is also a reason why these 5 states, and one is, Utah, as you know, is fairly rural, but these 5-state Mountain Wests are even more rural. So there are like a lot of joint issues that we already started to address in Utah, whether we worked on clinical trials that, for example, shorten therapy, whether we work on Huntsman at Home, which is a hospital at home program so that people don't have to travel to the cancer center. So like the issues of rural communities don't stop at the state boundary. And with no other cancer center in hundreds of miles of our neighboring states, we really feel a special responsibility to step in and serve. And we've done that informally already for many years, and now we're just doing it formally.
When? As of when? As of about now?
As of about June. Well, we should say, so Henry, so the broader catchment area was, or the broader area of impact was already presented in 2019 at our site visit, and we received an exceptional for our COE. And already then, I think the ambition and service that we had beyond our catchment area was well recognized by the review team. And then this year it was discussion with Henry at the NCI, and then our EAB, and then we kind of got the sign off more formally in our CAB, but we haven't really advertised this broadly yet. So this is a big step, I think, for us to talk to you, because we want to make sure from a cancer center perspective that people are aware that we're taking this on, and we have done a lot of strategic planning and a lot of advice from, like, one of our EAB members is Dr. Monica Bertagnoli, who is from Montana, who pointed us to people we can talk to and work with. So, I think HCI has long before me had a broad commitment through Dr. Beckerly for community outreach and engagement. And so this is just a logical step to make a difference, to go where nobody else is.
Oh, that makes a lot of sense. What's also interesting is going back 50 years, the National Cancer Act is really a public health legislation, and it establishes a network of cancer centers that's regionally accessible. It's just that your region is sparsely populated and nothing has grown except University of Utah, right? What happens in these areas? What is the quality of care?
Well, we do have a number of affiliate sites from HCI across the Mountain West. So we are trying to serve by, for example, some of our physicians are out there and seeing oncology patients, but we also have already made clinical trials accessible, and about a third of our patients travel more than 150 miles to come here to be on clinical trials. And we recruit, and a third of our patients come from that range too. So we're already successful in recruiting patients on trial, even if they live far away. And I think, those patients absolutely have that need to be receiving that best clinical care. We're now going to be the only proton center in the 5-state Mountain West. We have CAR-T therapy among adults and many, many clinical trials. So it's just, what is there? you can think of, like, for example, I don't know how often you've traveled to the national parks around here or this area. So it's like communities that are pretty independent. They have a lot of spectacular outdoor spaces. They have a willingness to work together to help their neighbors. But we have basically, we have a lot of nothing, right? You have a lot of distance to overcome. And that's the biggest challenge for our patients, or also for cancer prevention purposes. It's very hard to get a mammogram if you're living out in the boonies, right? And it's also hard when you're undergoing radiation therapy and you have diarrhea and you have to drive hundreds of miles to get your care. And so we're really, trying to think about those unmet needs, and the rural communities are underserved populations. They're recognized as such by the NCI, and They may not get cancer as often, but they have much worse outcomes, in parts probably because they are diagnosed at later stages. So there's a lot that we can do in kind of like this middle section of the country that has been somewhat overlooked.
But so basically you're talking about areas where hospitals have been dying for really a generation, where there's really not very much primary care, there's not much care. And you're trying to sort of build something there. It's an amazing challenge. Amazing. How I guess you're partnering with hospitals, but
we're partnering with hospitals, but I do want to emphasize also, I think and we have some affiliate sites, right, that are there, but this is not just about clinical care. This is really about a public health perspective as well. And so, whether it's smoking prevention, access to screening, we're working with, the American Cancer Society on helping with transport issues. I think there's a lot that comes together about just moving the needle to move the overall health up. And so I mentioned that we worked with different CAB members from those different states on their state cancer plans. And so, for example, colorectal cancer screening is a common theme where we have established working groups that specifically think about what can we do in those settings to make sure that screening happens. And so it's not just about care, it's really about impacting legislation. We've been quite successful in Utah in changing legislation, for example, on radon awareness or on skin cancer prevention. So these are all different avenues where we plan to tackle the cancer challenge and improve the health of the populations. It's like kind of given us a unified voice across those states to help advance cancer control. And we should also say what maybe has become clear a little bit when I say we worked with them on their state cancer plans. It's really important for us to see where they see the need, where our partners out in those 5 different states want to make a difference and to help them advance there. And, a lot of this has been overshadowed by COVID, of course, but it will move back to a larger cancer focus as well.
If you could help me with the timeline again, because it begins really before you get there, right?
Yes. Yes. So it started probably, we said about 10 years ago, where we have like this long time commitment, both through education and through partnerships. It became more intentional, I would say, especially with recruitment of Dr. David Wetter, and also in addition that, we have great people running our educational events throughout the Mountain West. They have already reached more than 25,000 people. So the statewide coalition work also happened already as part of the Intermountain West HPV Vaccination Coalition, the Rural Health Association of Utah, the Utah Tobacco Free Alliance, and there's like all these different things. So the HPV Vaccination Coalition, that's again a big challenge. Like HPV vaccination rates this is the area of the country where they're extremely low. And what can we do in terms of communication with providers, in terms of understanding survey and disruptive interventions.
I can just to add on to that. So I've been here since 2007, and our first cancer center support grant in 2009. We've always described Utah as our catchment area for the cancer center support grant purposes, but I think even going back then, there was an interest in and just an identification that we could expand our reach, because so many of the things we were doing in Utah, we were the only NCI cancer center in the region. And so, we just saw a responsibility to serve. For CCSG purposes, it was always focused on Utah, but Dr. Ulrich has now formalized the catchment commitment to include the whole region.
That's
some of this, Paul, was driven by, the NCI has actually opened up with their RFA a while back for people to describe their broader area of impact and not think so narrow-minded about, I need to meet certain metrics for this catchment area to count, because that, like, I think there had been unintended consequences of some of the wording apparently that made some cancer centers feel, you know, they need to define it so they meet all the metrics of a catchment area. And so I think that the NCI always wanted us to think big and want to change the world, rather than you want to define the catchment area, you need to meet certain metrics, but it doesn't have to be a everything is perfect in your catchment area approach, shall we say.
Yeah.
And our EAB has been very clear about that too. They said, you know, for your next review, just say what you strive to do, show where you made a difference. Nobody can expect that everything will be perfect. That's not the point. One thing, it's a very fast growing area of the country. You should know also, so people come to Wyoming, Montana, Utah, everywhere now. And maybe one definition, you know, when we talked about like the middle of nowhere, is there are actually definitions for rural and frontier. And most places never encounter frontier, but rural means it's fewer than 100 people per square mile. And frontier is fewer than 7 people per square mile. And so, and that's what we got here, is like large areas where it's very few people per square mile.
Will you be hiring doctors or prevention people? How do you actually truly expand this to move
Yes.
the needle?
Well, great question. But first, let me say one thing. Our vision statement and mission statement is actually to deliver the cancer-free frontier.
What kind of faculty and staff will you need for this?
Yes. So, well, we are in the process of hiring a new senior director for community outreach and engagement. The current team is fully there and strive to go as well, but everybody has been refocusing in different areas to really broaden their impact. So, for example, Dave Wetter is focusing now extensively on partnerships and grant writing. Dr. Aniga is focusing on a new population health assessment tool to really capture the state of the health, so we can see where we can make a difference. And we're hoping that with a new senior director for community outreach and engagement, who's ambitious and wants to maybe fill gaps such as working with Hispanic communities, which are very fast growing, that we can capture another big area or overcome another big challenge.
Oh,
We're not hiring a lot of doctors or anything. That's like, it's not about a clinical expansion, just keeping that in mind. This is not about saying we need to, we do have our affiliates and we serve clinically, but it's not about building 5 new hospitals across the mountains. That's not the intent at this point.
I see. So it's more population health. So that's really an amazing experiment rather in this. To think that it can be done, that I don't think anybody else is doing that either.
That's what our EAB said too. You know, our chair is Leon Platanius, and he was like thrilled, and he said he thinks this is a very bold move. And then we had a lot of good discussion in our EAB as how this will be perceived. We don't know yet at the next review, but we're not doing this because of the review. We're doing this because it's the right thing to do.
Oh, fascinating. Fascinating. Is there, have you traveled in those areas lately? Or so you must be out on the road a lot.
Well, COVID has not made it as easy as we thought, right? So a lot of activities like our community advisory board meetings so the CAB has been mostly virtual since COVID, but we have put in, for example, research grants together with Nevada, together with Wyoming, in terms of smoking prevention and other activities. Our doctors still go out to our affiliate sites, and of course our patients still come here. And we had actually last year the highest enrollment ever on clinical trials overall for our cancer center was close to 800 patients. So that is still happening. I think cancer definitely was a little bit postponed during COVID, but now it's catching up. And so we're seeing those patients, but we have not been able to travel as much as we wanted to because of the number of restrictions, as you can imagine. So we can't wait for the pandemic to be over.
Then you can, yeah, this is just an amazing story. It's hard to even to get my head around it, because there's just two things that are so unusual. One, taking on more territory. Two, really taking on so much more territory. And I guess there's one more, which is that you're doing this through mostly outreach and engagement activities and population health and prevention, rather than building hospitals. I don't think anybody else is doing anything like this.
That's correct. I think there's nobody else who's been doing that. There is one cancer center that has also a large catchment area, that is Hawaii, because they serve the Pacific area basically. And so I think they've been thinking big as well. And we have a phone call scheduled with them to hear about their experience and what they've been doing and what works and doesn't work from their perspective. But you need to have a clear plan and be realistic about it too. It's definitely going to be a stepwise approach.
Oh, fascinating. And what's the final step of it? Will there be providing care as well? Or well, recruitment for clinical trials, you can start that now.
Yes, right? We have that now already. So we have about it's about close to 30% of our patients come from the Mountain West states to be here at HCI. And so we already serve as the referral center, as the go-to center for top-notch clinical care and clinical trials. Not for all parts of every state, but you know, we have maps that show from all these counties across the Mountain West came patients to be seen here and to be on clinical trials. And it's just, I think it's a little bit also because the culture is similar between Utah and the Mountain West. As we discussed, it's the Wild West, maybe a little bit. It's the frontier, and it's not so much like the big city people.
Oh, it's really incredible.
The rural populations are clearly underserved, and I think it's hard for us to imagine, who have such easy access to healthcare when there's a problem, what it means to think about taking on the drive for another therapy or not, and or having a snowstorm coming and having to go over a pass, right, a mountain pass. And so I think that is just something that we really strive to think very creatively about. It's the program that we call Huntsman at Home. It's really the first oncology-specific hospital at home program in the United States. And we currently serve 3 rural counties in Utah as part of a pilot study, but we hope to be able to expand that at some point. You know, we work a lot with GMAP. We have large American Indian population now in the Mountain West. We have a very large growing Hispanic population. And otherwise, it's really about addressing the needs of rural and frontier populations. I mean, I guess the other thing, there's 2 other things. One is about just education and training. Is we actually see this very much as a bidirectional effort, and we have programs in place that bring underrepresented students from the Mountain West here. For example, we have a rural high school program, and it's writing to schools in the rural areas and bring them here. We have the Pathmaker program, which is for underrepresented undergraduate students. And, you know, when you hear their stories, it's just amazing. I mean, some of them are like had a family of minors, right? They've never had any advanced education. They've joined us for our internships here and then decided to get more education, and pretty much all of them have graduated afterwards. And some of them have gone to MIT for internships. And so we're really trying to educate the next generation of scientists also across the Mountain West. And, as you know, it's really critical to do good science communication these days. And there's like a lot of misconceptions about science. And we need to engage in this bidirectional dialogue to share what's important about our research and why it matters, and that it's not scary, and that it can make a world of a difference. We have some great partners. We have the Association for Utah Community Health. We have, partners in Nevada and Montana already, and we also got a lot of grant funding already. So that's been great. We have already about $30 million in grant funding to address the needs of the catchment area. So it's been just something where everybody is really thrilled about it and wants to do it.
Oh, absolutely. It's the right thing to do. Well, thank you so much. I really appreciate your taking the time to talk with me.